We were only a couple of the people, and Professor Mubashir, that time she was fresh from UK, and after completed MPH in London, she had joined. And we were all looking yellow to all of us in the university, new university, and what these people don't have anything, they are starting this useless program of MPH, like this, like that. And because I was the registrar and our vice chancellor also ardently supported, everybody just shut their mouth, nobody said anything. This is how the Department of Public Health started. And it got evolved, I said. Now, today, the department, I will say that in all of the about some 35, 40 districts of Karnataka state, every district epidemiologist is a student of II Institute of this Public Health of KL University. There cannot be means, and many of the people have gone WHO UNESCO placements. This is one sentence to tell about the credibility of the program. And of course, that time I remember very well, even it was not listed in the list of the degrees permitted by the University Grant Commission. UGC always publishes some list, and it was MSc Public Health. And now I remember as a registrar, I corresponded in everything, we got that and got it included in the list of the programs recognized by MPH. This is what is the real journey. So after that, and after there is no looking back. Now the greatest moment is the name of the MPH appeared in the NAC assessor's report that this department's contribution for getting A+ by KL University is significant. And Mubashir, you can say my good friend, was called, and she was specially acknowledged by the NAC peer team. That means why I am telling this is she is not from this place, she is from state of Kashmir, and she came to Belgavi in a strange place, in a strange environment. This lady put her dedication, okay, against all odds. Now she stands straight, and it is nice to see. I have not recently gone to the Department of Public Health. She said, "Sir, you come here. Probably I might miss a beat also by looking at the progress." It's a wonderful thing. This is how I like to introduce Professor Mubashir. She is right now the PhD scholar. In front of me only she got promoted. In front of me only he got professor. Now she is a PhD guide guiding 6 PhD programs. Apart from that, she has got nearing 100 publications, scientific publications. She is a Cochrane reviewer. She is a principal investigator of ICMR, even some NIH funded projects, US funded projects. She is a co-principal investigator. That means a person puts her, and she is the associate editor of the journal of this Rajiv Gandhi University of Health Sciences. The other day, one person who shared this platform was the editor. Who was that, Mahalakshmi? Recently.
Sir, Dr. Bala, open access one, Dr. Bala.
Bala Bhaskar, so I'm so happy all my friends or followers are doing this. I'm very, very happy about that. And she has got apart from that, she has other credentials also. She is the chairperson of the ethics committee in some institution, other institution. And she has done the course in the pediatrics ethics, from University of Kansas. So always, she will be on the toes. And I'll say she's a good friend of that ICMR lady, Nalini, Nalini, who runs the bioethics course. So this is how the network. Sir?
Nandini.
Nandini, yeah. So this is how, she developed and she has evolved. And I gave a very great simile to Dr. Gaudar like that. And now she is a very popular teacher and in many publications, many responsibilities. And that's it, And what more to a teacher if all your students are occupying all the district positions of state? That is the best reward anybody can think of. And Mubashir has got a long innings to go for her in her career, and certainly she will continue to play like this and reach further heights, bringing credit to everyone, everyone. This is about the introduction to her, and a couple of sentences, of course, I have to tell about evidence-based public health. And now I remember during our tenure only, we started the public health Karnataka State Chapter of Indian Association of Public Health, and that was formed there. And now, right now, she is the secretary of that. And you all know that Indian Journal of the Public Health, quite a credible journal, lot many articles are there. This I remember very well. And about some thoughts about the today's topic, the concept of EVM, after 80s. Within about a decade or so of that, the concept of individual application of the evidence to the patient care, it is for the community as a whole. So best research evidence, then the values of the community and the expertise of the persons, that constituted the evidence-based public health. And we all know by application of these evidences, the lifespan of a developed country like America has been increased by 30 years. This is what the literature says. That means what is the evidence-based public health? Good sanitation, good water, those kind of things. If you take care, the patients suffering, patients dying will automatically become less. So that is one typical example of the importance of the evidence-based public health, which it can be beneficial to the mankind. It can increase the lifespan itself. The other associated quality of life, etc., will obviously be increased. So this is the one thought that comes to my mind about this evidence-based public health. And another thing is, these various facilitations are available. The watchdog of the diseases, the CDC, CDC Atlanta in USA, that also has several facilitations for the practice of the evidence-based public health. They have got tools as well. They have got assessment tools also, the indicators. So many facilitations are available. And with these few remarks, and now one more thought about this. The COVID pandemic has given a very great message for all of us about the importance of the public health. What more you want, evidence-based simple interventions like washing the hand with a sanitizer, alcohol, destroys the corona virus. Then simple distancing, simple face masks. These are all the evidence, they have been there, which have made the control. Such a big pandemic has been under control, we can say. Of course, after that peak, lot many things have happened. But the importance of the evidence-based public interventions cannot be there better than that for the COVID, how we all fought. So these are some of the thoughts that have come to my mind. I think enough now. I will go on talking. Otherwise, we'll leave it to Professor Mubashir Angolkar. Mahalakshmi, you want? I already introduced.
Yeah, thank you very much, sir. Before we hand over the stage to Dr. Mubashir, I would like to announce a few things. I'd request the participants to keep themselves on mute so that the audio quality is good for everyone. And this program is being live streamed as well as being recorded for academic use posteriorly. Over to you, Dr. Mubashir. The stage is yours.
Thank you so much, Dr.
I'll move the slides. If you say next, I will move to the next slide.
Thank you so much. Thank you so much, Dr. Mahalakshmi. At the onset, I would like to thank Dr. P.F. Kotur sir and yourself for giving me the opportunity to speak on such a prestigious platform. And it was very modest of sir to say, my friend, he's my guru. I'm a student. And yes, one thing he rightly said, like for me, it's a very proud moment when my students are successful. And our success, sir has to take credit to. He has guided us. This department has grown in its initial stage only because sir's guidance and support was there along with other university officials. So, sir, this is your baby also, this department, and the success goes to those who have put the foundation stone for this. So with those, thanking both of you, I would like to play a small video. I don't know if it will be able to, you can click. If not, it is of Keli University. But I will also read Keli University, which is now called Keli Academy of Higher Education and Research, was established on 13th April 2006 and today is NAAC A+ accredited with a sweeping 113-acre Wi-Fi enabled campus and it has come third prize for Swachh Bharat Campus. It's ranked nationally for Green and Clean Campus. It has 10 constituent units, health science units, Ayurveda, pharmacy, dental, medical, nursing, physiotherapy, and so on. And we have 25,000 plus alumni and 51,000 plus students from across the world. I think one alumni has joined today, prestigious. So the Kelly family is a very close-knit family, and it gives us a lot of immense happiness when we see another alumni. Thank you so much. We it's a challenge to talk about evidence-based public health in front of Dr. P.F. Kotur, whose PhD is on evidence-based medicine. But I hope I will do some justice as a public health professional here. So we will, next slide, please. Yeah, this presentation will revolve around what is evidence-based public health, why it is important to practice evidence-based public health, and how to practice it, the framework, the resources which we can access, and how to improve the current practice of evidence-based public health. Next. Next. Yeah, so beginning with from the inception, we all know 1992 was when evidence-based medicine made a revolution in medical practice, and it hailed as a new approach in teaching medicine. This led to a host of evidence-based approaches, including ethics, occupational therapy, dentistry, nursing. Everyone started talking about evidence-based practices. So in 1997, that's almost a decade later, Mr. Jenisic, he was a public health person, and he coined and started the concept of evidence-based public health. He also said that both evidence-based medicine and evidence-based public health, they draw their foundation from epidemiology. It was by 1999 that scholars and public health practitioners from Australia and America started advocating this concept of evidence-based public health, and they were elaborating on this concept. And Brownson et al., you will see maximum work publications by him, started defining public health, and he at that time called it the development, implementation, and evaluation of public health programs through application of principles of scientific reasoning. Scientific reasoning, this is a very important word here. So today a consensus is there between public health leaders and practitioners that a combination of scientific evidence, values, resources, and context should enter into decision making. Next slide. So the definition of evidence-based medicine, I could find the most recent in 2015, is that it involves conscientiously working with patients to help them resolve or cope with problems related to physical, mental, and social health. On similar lines, 2004, that's the most recent definition by Kohatsu, is and this definition has evolved and improved. The recent is this, that a process of integrating science-based interventions with communities. Instead of patients, now we are talking about population. So integrating science-based interventions with community preference to improve health population. So involvement of the community was made important here. Next. What are the factors that drive evidence-based public health? Now we know the development of the computerized database and evidence strategies has facilitated the growth of evidence-based medicine and evidence-based public health. However, in addition to evidence, we have to accept that politics and timelines, like sir just now said, COVID. So they are factors which have pushed public health decision making. Clearly, one of the overriding factors has been the overwhelming growth of medical literature, and increased access of the internet continues to expand the availability of medical information. However, the problem now is with this plethora of information, of evidence over there, how does one quickly and efficiently obtain high quality information that is relevant. Next. So the domains that are influence evidence-based public health are best availability of research evidence, population characteristics, the needs, values, preferences, reasoning, including practitioner expertise, the environment on the whole, and organizational concept. However, I would cause a word of caution here that application of this model should be evaluated also with respect to the quality of the science base, the involvement of the community, and the effect of the desired population health outcome. So it is very important to remember, next slide. It is very important to remember and understand that public health interventions are different from medical interventions. Firstly, the scale. Public health interventions usually operate at a large scale and address issues that span clinical, behavior, and structural dimensions. Secondly, situations can vary so widely in public health, the external validity or generalizability of evidence to other situations is absolutely crucial for public health applications. Thirdly, we have to understand the complexity of the interventions. The complexity of the interventions are determined by what is best set of interventions for a particular setting. How does the intervention be delivered with existing system, and what will make this intervention sustainable? So Brownson et al. Have put forth this framework of evidence-based public health. It is very similar if you see to the steps of evidence-based medicine. In evidence-based medicine, what do? The first step is to develop your research question, then identify the relevant interest, determine best evidence and course of action for the patient, and evaluate the process. Similarly, for community, when I am trying to apply these steps of evidence-based public health, one would do community diagnosis and assessment, develop the initial statement of issues, search the literature and organize the information, develop an action plan and implement the intervention, and evaluate the program and policy. Now, the third step here, search the literature and organize information. Next step, next please. When we see public health evidence is usually a result of complex cycle of observations, theory, and experiments. And today, evidence is only a click away. So getting organized information is very important. And people who access this evidence should know websites or sources like the Agency for Health Research and Quality, AHRQ, whose mission is to produce evidence to make healthcare safer, higher quality, and more accessible, affordable. Then there are other sources like REAIM, which is an acronym for the framework 5 evaluation components, that is reach, effectiveness, adoption, implementation, and maintenance. Through these components, the impact of innovation can be assessed by both the individual, who is the end user, and the organizational level. So the community guide, that is another, when you Google, you see it can be used to educate public health professionals, assist with student projects, and inform communities about evidence-based public health. So like I was saying, evidence is a click away, but one should know the right resources, where to go. Talking of evidence, next slide. Talking of evidence, there are forms of evidence. So broadly, again, Brownson has classified them into objective evidence and subjective evidence. We know that through systematic reviews, scientific literature, public health surveillance data, program evaluation, there is evidence which is peer reviewed, which is scientific. And then there is evidence which is very subjective from media and marketing data, word of mouth. Nowadays, WhatsApp messages have become the kind of new evidence people will talk about and say, oh no, I read this on WhatsApp message. I know this is why you have cholesterol, or this is why people are losing interest in having an active life. All this information based on WhatsApp messages or personal experiences are low quality evidences. So very rightly put by someone, like beauty lies in the eyes of the beholder. Evidence lies in the eyes of the beholder. So it is the onus of the practitioner, the public health leader, to ensure that objective evidence are considered in decision making. Next slide, please. So since one has to practice evidence-based public health, it is important to look at the types of evidence. We have emerging evidence, promising evidence, effective evidence, and then evidence-based evidence. What is emerging evidence? Let's take it one by one. Next slide, please. So emerging evidence are like evaluability assessments, pilot studies, projects funded by health foundations. This is something like an ongoing work, which is practice-based summaries or evaluation works in progress. Now, they are very formative evaluation data and potentially high-reaching face value. Next. Next slide, please. Promising evidence. Promising evidence is the written program evaluation without formal peer review. So this is like cumulative evidence of effectiveness, formative evaluation data. These are state and federal government reports which have not been peer reviewed. So obviously one has to question their credibility. And they could be also conference presentations. Next, please. Third is effective evidence. Effective evidence is which is peer reviewed. Articles in the scientific literature, research tested and intervention programs, technical reports with peer reviews. Now here we have external validity. Here cost and cost effectiveness has been assessed. Risk and benefits have been assessed. So this effective evidence is a type of evidence which is something that we would look at before we are making evidence-based public health practices. Also, the next, which is evidence-based evidence. Next slide, please. Evidence-based evidence is also peer-reviewed via systematic or narrative review. So it is a higher degree. How we have hierarchy of evidence, RCTs, but above RCTs are the systematic reviews of RCTs. Similarly, here we had the effective evidence, and now the evidence-based evidence, which is like a peer systematic review of this. And this is also peer reviewed. This is also based on study design and execution. And the examples are, which I had told in the beginning, community guide, Cochrane or Campbell reviews, where scientifically, methodologically, evidence has been extracted and put for us to apply in practice. Next, please. So these are some resources, next few slides, where one does not need to go and assess the information that is there. It is already assessed. Most important resource that has fostered the development of evidence-based medicine and the utility of evidence-based public health is the Cochrane Collaboration. The collaboration's health promotion and public health is aimed at increasing the quality and quantity of systematic review that can be used to provide evidence to answer. I myself am a Cochrane review author, so I can tell you it takes us about a year to only get our protocol first designed and approved by peer review. Even before we do a systematic review on a Cochrane base, we first have to write our protocol, that how we are going to do it. That will be peer reviewed, we'll get extensive feedback on it, and then that is published, and then we do the actual review. And all possible information available, even in other languages, even in sometimes gray matter, everything is taken into account, assessed, each and every information assessed on a criteria which is pre-decided in the protocol, and then only those evidences or those those articles which we assess to be valid, the validation is tested, and those which are valid are then included. So obviously the result, what we write, concluding remarks, are something that the practitioner can take directly from the review and apply to the practice, because it's undergone a very rigorous methodological scientific evidence to be produced. Next, also other sources which one can look at and does not need to again assess the information are guides to community preventive services, guide to clinical preventive service, cancer control planet, US National Registry of Evidence-Based Programs and Practices. Now we have India Registry of Cochrane also, India Cochrane also, which is accessible, and scientists and researchers right now are working in putting information relevant to our country on that. Next. So what is it that I'm looking for? When I'm looking for systematic reviews, I could go to Cochrane, I could go to health evidence. Next, I can go to this health evidence again, McMaster. So these are different sites that you can go to when you're looking for systematic reviews. But you could also be looking for evidence-based guidelines. Next slide, please. So the community guide, which I mentioned earlier, also gives you only evidence-based guidelines. Next. Also, NHS NICE gives you evidence-based guidelines. Then we have pre-formulated search. Next. These pre-formulated searches, there are websites like Policify, which will take you there. Then we have bibliographic databases. Bibliographic databases are like PubMed, Scopus, Web of Science. Please do not go to Google Scholar, because everything comes over there. So again, I would emphasize on PubMed, Scopus, Web of Science, and such databases to be encouraged to be accessed when you are trying to make a evidence-based decision. Next slide. Then there could be, when you're looking for health impact assessment sites, so there are lots of authentic websites to go directly to and look for evidence-based evidence over there. Next slide. And decreasing in that order, then we also have books, other journal literature, health impact assessments, government reports, listservs, alert systems, internet sources. But remember the hierarchy of the evidence, of hierarchy of the strength of the evidence, and imbibe them, inculcate them when you're making your practice, when you want to put them in your practice. Now, this I told you are the sources or resources where one can go and access, but also what to look over there. So next slide, please. It is very critical for us to have a quick, structured way of looking for the answer that I am looking for. I mean, these are all sources with plethora of evidence, but with plethora of evidence, it's empirical to know how to draw relevant information that I am looking for. So the main websites which I told you, which were systematic reviews in particular, they do not need to be reviewed again. They are peer reviewed. You can just accept them. Even the evidence-based guidelines of NHS, NICE, I said, you can just adopt them. But if you're looking at other journals, other resources, then we should have a small, quick way of assessing that information before we decide to incorporate it in practice. So very quick steps here I have put in just 6 steps is that we should be able to frame our research question. We can always use the PICO framework. So note down what patients or population you are interested in. What is the problem that you are interested in? I for intervention, exposure, or the test that is you want to see whether it works or not. C for the comparison intervention, that this intervention versus what am I comparing it with, and O, the outcome of importance, that is it relevant to what to my country, to my local area. So based on this PICO framework, you frame your research question. So you have a very fixed, focused question, that what am I looking for? Then based on the question, you would select your database or the website, or know that which source should I access. Like, for example, I said Cancer Planet. So if your question, your population of interest was cancer patients and their treatment, you would go to Cancer Planet and accordingly. So based on your research question, then you select your database and then choose a strategy. You will put filters in it with your question, and you would make kind of a methodological standard for evaluating the study's scientific quality. Then perform the review so that it can be reproduced by others also. So this is how we synthesize the result. We encourage in evidence-based public health to look at Cochrane and such websites, and somebody has already done a lot of hard work and made it ready to save our time. Do not try to rediscover the wheel or reinvent the wheel. When things where work is done, just take them. Where you might find a research question which has not been answered, then it would be nice to do. So yes, please, next. The barriers would be political environment. There would be your deficits in relevant and timely research information system. There'll be hurdles with the leadership at that time, which is again a political environment, and the required competencies. These are, of course, the barriers for practicing evidence-based public health. So next, please. How do I improve on evidence-based public health practice? So addressing the need to improve the quality of studies. There is in place something called trend statement, the transparent reporting of evaluation with non-randomized design. It falls in the format of the CONSORT, CONSORT, which we follow for RCTs, the Consolidated Standards of Reporting Trials. Similarly, for community-based, we have trend. And also we have grade in response to the variability in ranking systems used by various health-related organizations to assess the quality of evidence and the strength of recommendations. Grade system has been developed. Grade stands for grading of recommendations, assessment, development, and evaluation. Then we also have, for more community involvement, the CBPR, that is community-based participatory research. It is an approach that entails involving all potential users, stakeholders, and in the formulation as well as the application of research. Community-based participatory research builds on resources with the community, facilitates collaborating among all parties, and integrates knowledge and action of mutual benefit to all partners. Then thirdly is the effect on desired public health outcome. I think the most important one is to ultimately determine that if the importance of that public health intervention or approach has been effective. And so one would see whether it has reduced mortality or improved the quality of life, decreased the risk factor prevalence, increased adoption of the healthy lifestyle. However, evaluating evidence-based public health is not as simple as would be for evidence-based medicine because of the complexities of the communities and the interventions. Next. So, sir already told you in the beginning, Department of Public Health has been practicing evidence-based public health. We have so far had 461 outreach activities, reaching to a number of more than 87,000 beneficiaries, school children, factory workers, then even old age homes, we practice whatever we learn. Our students are very active in the field. Next slide. These are some of, next slide, please. These are some photographs that I am sharing, and we are supported by Department of ENT, Ophthalmology, Medicine, OBGY, all departments together. That is one uniqueness of this department, that we could go with, yeah, one step back, please. Yeah, that with all anesthesiology, orthopedics, the Department of Public Health kind of bridges and ties all the departments of the medical institute and works together. So thank you. This is before COVID, when Swachh Bharat Abhiyan and Shramdan was some very active things that we were doing, but these photographs are from before COVID. Thank you. I would be happy to answer if anybody has any questions.
Thank you for that very nice and comprehensive talk. Before we take audience questions, I think we'd request the audience to put their questions in the chat box. Now, one or two things which came to my mind when I was listening to the talk. We keep talking about hard evidence all the time when we want to make a lot of policy decisions. But right in this forum, actually, we had one of the talks by one of the young community medicine personnel from Chennai who spoke about qualitative evidence influencing policy making in healthcare. So he was talking about one example of a mother who has lost a child during postpartum period. She was housed in the same ward as other young mothers with children, and how it affected her. And then the government came up with some policy like that. So can you actually give some example of this role of, can you elaborate on the role of soft evidence in qualitative studies for public health?
Yes, some of the achievements of evidence-based public health, I should say, is from literature. One of them is, they say that life expectancy in America has increased by 30%, and they give the credit for that to evidence-based public health being practiced, which of course includes, safe drinking water, sanitation, and all those things which have played a role. In particular, with soft matter, qualitative research, policies within hospitals or in smaller communities, we have lots of examples there, yes. But I think for India, we have such major problems, and we are so focused on quantitative data with our population base so high, that on a national level, I cannot think of any policy that has come out like that. But yes, from my experiences, I can tell you that community-based. There was, for example, we had gone to a blind school, and the students were there doing their outreach activity. We were doing a health checkup for them, and they were so touched by, these children had to be moved and done. At the same time, they saw that they're very smart. They're all giving 10th standard board exams. They have these audio recorded, and they did a small quiz program for them, and had the blind students, actually, they won that quiz program because they had identified that they're very smart, they know things, but at the same time, they were especially with those with special challenges. So we had a small, our students themselves did that. Every week they would go there, and they would not do any awareness program, not teach them, but they would have these competitive programs with them to encourage them that they are doing better than us in many ways, identify. But no, at national level, I am not aware of any such policy that has come up yet. But from your experiences, we learn something, and then we say, yes, let's make this a policy here.
Thank you, ma'am. And there are some questions in the chat box. One is from Dr. Jennifer John. So he wants to first compliment you for a wonderful presentation. Do evidence from focus group discussion, which is qualitative, can be applied to public health? I think that is a variation of the same question which I was trying to ask.
Yes, definitely. See, any type of qualitative research is first step to generating that research question. Then one takes it up to quantitative research. But social science, we lack in it, but now the evidence-based public health is teaching us that to go one step back. And the whole community involvement, it comes from there. How do I do community involvement, which is one of the very integral part of the definition of evidence-based public health. So by doing focus group discussions or in-depth interviews or participatory, we undermine participatory observation a lot. But I can give you examples where participatory observation has been very core to decision making. So this is from London. I'm sorry, it's not in India. But a friend of mine was given this assignment to sit in the parks and just make notes. We all students in London do part-time jobs. And this was a part-time job. Every Sunday, sit in the park. There were designated places where we all would sit and make notes. And our notes would be which swing was used by how many children, not used, which food truck was it had more people going and buying, or the path which was neglected, and based on that, the new parts they would plan that what should be there and what should not be there, and by simple participatory observation, there were a lot of policies that were coming in place. I remember she telling me that she had written in her report when a child fell from a swing and it was sand down everywhere under the swing, and the child was laughing. And then we were told, I remember in our class, that that was actually a finding, and it was from evidence-based practice, you can say that there should be sand under the swings because children are going to fall. And when I came back to India, and here I saw complete parks, whatever slides and swings are there. Only sometimes there is sand. Usually they are concrete and they will put. So then I remember putting it up with the DC, and it was well accepted. So these some observational things which come from qualitative research, or sometimes even through focus group discussion, can be very enriching. We could actually get very good information to be but that process has to be there. Like it should go through to the right people and be put up over there so that it's transformed to a policy.
Thank you, ma'am. I'm sure Dr. Kotur has got some questions. Sir, over to you, sir.
Am I audible? Problem.
Voice is echoing a little, but you are audible.
Yeah. I was logged in from two sources at a time simultaneously. 1 second. Now I am audible?
Yes, you're audible, sir. Only there is a little like double your voice is coming, but I can hear you.
Yeah. Now, like some thought or a question you can think, Dr. Mubashir, in the three components of the paradigm of the evidence-based medicine while practicing, the one patient's values are the important ones, which vary from patient to patient. And many times the person who is practicing will find a difficulty in understanding, honoring those values, because your value will have some kind of a conflict. Now you have to take the values of the community into consideration while you want to intervention. So that means those many number of subjects or participants or people are there, those many values, because values differ from person to person, depending upon his upbringing, depending upon his culture, depending upon his education, depending upon. Yesterday I was reading in this the city of Kharkov or something in Ukraine. there are the two groups, each group with a different values. So it will lead to like that. Now you go in the field every day, I know. Do you have anything, which you use, in your such a long journey in the public health, which can kind of unite the values of the people, especially for their good only?
Yes.
Rather than sticking on to a single value, ego comes in between, because to respect the other person's value or not. So what is your thought on that?
It's a beautiful question, because ethical dilemma, which remains sometimes even in hospitals, when you have a patient who has a different value, and you, to save the life of that patient, may be thinking differently. Like, for example, I know in certain communities, blood transfusion is not acceptable. And sometimes if blood transfusion is the only way to save that life, the doctor is totally bent upon doing it, whereas the patient and the people who are the decision makers with the patient do not want. Similarly, in the community also, yes. And as you said there, it is one person here, different values. First of all, it is mandatory and important that we have to take the consent of the community. That goes now without saying, that consent has to be there. You cannot just put things on them. So that is why, even with, when HIV testing was a big issue in India, and we wanted to know, I'm talking about at least 2 decades back now, when we were not knowing the exact prevalence of HIV in India. And WHO and all were saying that we are sitting on a time bomb. So we had to know some prevalence. Then there was a decision taken at the central level that at high risk behavior people, blood will be, samples will be taken, and they will go to the central lab with total confidentiality and delabeling, and we will at least know the prevalence there. So when it is something where the other people in the community, because of one, others are at risk also, if it is something related to just one individual, they can have a consent, give consent or not. So for example, taking vaccination. Vaccination for polio was not something that you would infect others with. It was for your self-protection, and we could respect the values of people if they didn't want to take that vaccination. But for COVID, the story was different. If they don't take vaccination, they also become carriers, and they can be, harmful. It can be harmful for the others then around them. So even then, we could not force it on them. I mean, their consent does take the higher platform above other things. But many a times we come out with some board. This is what has been actually now proposed, that for communities there should be a board. How in a hospital you have an ethical board, and it has members who will take decision on such patients where there may be an ethical dilemma and conflict between the doctor and the patient, so that ethical committee board takes a decision. Similarly, in communities, they have proposed to have a board which will have representatives from all sectors, and in such dilemmas, that board will take a decision.
No, who
But it's
in
only
India?
proposed.
Yeah, that's good. Thank you. Who in India takes the responsibility of evolving evidence-based interventions? You said 30 of your students are in the district, every district health office, they are there. And when they have come out of this, they must have been sensitized for this.
Yes.
You need a platform. Even to take individual evidence-based decision is not an issue. When it comes to the departmental constraint, it is difficulty.
Yes.
Like that, for India, for our state, who takes the responsibility of generating a policy based on evidence-based interventions? Is there any machinery?
Unfortunately, I won't say there is a machinery, but there is enough sensitization that for health issues, like for example, ICMR, they give recommendations even if it's a political thing, isn't it? Health is at a state government level, and pretty much unfortunately governed by political wills and wishes. That was one of the things I said, that one of the barriers or driving factors for evidence-based public health was political will. Sometimes if the wind blows in the right direction and there is political will, we will have things happening. Sometimes it's in the opposite direction. But yes, the onus is at that time on these epidemiologists whom we have trained, whom we have put their foot down. Many a times I have also faced, sir, an issue where in the community, what is ethical and what am I doing or what am I expected to do? I think it's the integrity of the person at that time to put your foot down and say, I'm going to do what's the right thing to do. Unfortunately, we don't have a machinery that would itself make us do the right things. But in the end, to each one of us, I think if we have that much integrity, 99% of our problems will go away. They are difficult at times, but like I said, then each one of us should have it. So all epidemiologists, not only from our institute, others also are sensitized. It's a core subject. So they are sensitized, they know it. And like for other things, how we say the future is in their hands, for this also. And I'm happy to see some of my students who are UNICEF state program officers or WHO SMOs, and they share their stories. And sometimes when they say, ma'am, I put my foot down, I said, nothing doing. This is how it's supposed to be do, and people then fall in place. They do actually agree. So I think such stories have to be passed forward, that for doing right, if we put our foot down, usually people will also give in.
Yeah, that's good. Thank you, Dr. Mubashir. This your Association of Public Health or Public Health Foundation of India, these people have a responsibility of generating such kind of documents for the. Okay, thank you very much
now
for
with
your
Cochrane India, that is one thing, sir. Only last year, 2021, now Cochrane India has started, and one of the responsibilities on them is going to be to generate evidence-based guidelines and evidence-based database for Indians to be able to put it in our practice. So yes,
public health.
Public health. Not only public health, sir. Not only public health, even evidence-based medicine. 2021, I'm not sure, but it was in the last months, October, in November, first week or something, we had this launch of Cochrane India.
Good, thank you very much.
Madam. There's some very interesting question in the chat box raised by one Dr. Sushma and followed by something similar line from Dr. Prashant Gowda. What's the best way to evaluate success of a public health intervention? And Dr. Prashant wants to know, with reference to COVID vaccination, what is your thoughts about health impact assessment and cost effectiveness analysis? So maybe you can make it in little simpler terms and tell all of us, madam. Maybe this person is a public health personnel, I suppose, is useful.
So, first of all, the first question, which was to evaluate evidence-based public health, it's very difficult. It's acknowledged that it is high. I mean, we are not talking of one individual evidence-based medicine that there's a disease, a treatment, and you see the outcome now, whether it worked or not. So it is very difficult. Like Dr. Kotur himself was saying, there's so many people with different values, different scene, different. So the complexity of the communities and the public health interventions, it is very difficult. I totally agree. And then you said in particular with COVID vaccine, the cost analysis. Well, for now, the government has given for free. I think it's we have not had a cost effective analysis done on it because it's been given for free, and still people have not yet, we don't have that high rate of vaccination. Luckily, we have crossed 50%, but yeah. I'm sorry, I don't know the cost analysis of COVID vaccination.
Okay, madam. There is one another question from Dr. Arun Daniel that when we ask people to write review of the references, we ask them to restrict the references to 5 years from the past literature. So does evidence have a time limit, time span, like does it have an expiry date? Okay, and how long it remains valid? So that is
Yes.
what it is. Especially the trend analysis from older database. So that is
That's
what she wants to know.
That's a very good question, Dr. Arun Daniel. So it again depends on your research question. If it is something that lot of work has been done on, obviously you would want the most latest. Why 5 years, last 2 years, last 1 year? Because it's extensively explorated and evidence is there. Now, if it's something on a rare disease and you have limited information on it, limited data, you might even have to go 10 years back. So it will, when you do your literature search, it will depend on the plethora of information available for that question. So like I said, the first thing when you formulate your research question, keeping the PICO framework, when you you have to spend a lot of time in formulating your research question. We kind of just make a quick question. Please do not do that. Follow a PICO framework or a SMART, where you are specific, measurable. Uh, then R is for reproducible, T timeline. So put these things and make your research question, spend time on making your research question. Then depending on how much work has been done in that field, that expiry date you will tell, because see, with COVID, things were getting outdated. We were talking about herd immunity and we were talking about uh, things which we ourselves then said, no, it's not going to happen here. Our own information was getting outdated in months. If it's a technological based question, I'll tell you, I was attending this, the shelf life of technology based knowledge today is 2 years. And the debate is that the engineer who's coming out in 4 years with his degree, the knowledge that he has gained is already outdated before he comes out. So what is your research question is very important here, to know the timeline to put your filter for last 5 years or 3 years, what you put it. But that's really a good question, because something gets outdated very fast.
Thank you, ma'am. Actually, we were discussing a little bit about you want your students to put down and what you want the epidemiologists in the policy making to do what the right thing. I think there is a very philosophical one from Dr. Mithila Damayanti. She is asking when we do the right thing, many a times it is we are alienated and you are alone kind of thing.
Yes, there may be a fire.
Yeah, that's so. What do you have to say to Dr. Mithila, madam? How do we overcome this?
I will still say, put your foot down. To begin with, to end with, what is right, and people will start seeing it. You may have some, backfire and some temporary setback, but if you stick to it and you stick to it long enough, people will see and respect you for that. Trust me, I'm telling you. Dr. Koto told you in the beginning that how she's in a different place, different this, but I think that is the key. What is right is always right, and just stick to it. And no one needs to tell us what's right. Our gut feeling God has put in that, that what's right, and just do the right thing always. Temporary setbacks.
Yes, madam. That was a very nice message, motivational for us to take from this particular session. And with that, I think we try to close this session. And thank you very much for a wonderful session. It was highly interactive. You finished well on time. And you took a lot of time to answer a lot of questions. Very interesting session. Thank you.
Thank you. Thank you
and,
very much.
On behalf of the Scientific Society of AVMCH, the Constituent College of Vinayaka Missions Research Foundation, myself, Dr. Mahalakshmi, thank you for a wonderful session. And for the convenience of the participants, we'd like to say that we'll explore this theme of priority areas in public health. And our next talk is going to be on the public health delivery models in India. Now, a lot of changes have come in with Mohalla Clinic and Tamil Nadu government introducing 24 hours PHC care, and a lot of changes in various levels which is happening. So we would be actually having a talk by Dr. Sudarshini Subramaniam. She is associated with Institute of Community Medicine, Madras Medical College, and she is one of the key players in the delivery of Community Health Services in Tamil Nadu government with the DGHS. So she will be talking to us about the public health delivery models in India next Friday. So with this information, I'll close today's meeting, and I will we'll meet you next week. Thank you very much. Bye bye.